This is Abraham Sir. I'm a cataract and glaucoma specialist in San Luis Obispo, California, and I made this presentation in order to provide you with key information about cataract surgery in order to supplement your discussion with your surgeon. The goal of this presentation is to help you understand the procedure, its benefits, risks, and what to expect so you can make an informed decision. Please review each slide carefully. Discuss any questions or concerns with your surgeon. Let's start off with a typical presentation. I want you to meet Joe. I'm 66 years old and I've got blurry vision. I cleaned my glasses, but that doesn't help. At nighttime, headlights have rings around them. I tried new glasses, but that did not help me either. My wife surprised me and took me to a fancy restaurant. It was dim inside and I could not read the menu. So here's a typical presentation of someone with cataract surgery. It's someone over the age of 60 years old. And symptoms of cataracts include blurry or cloudy vision, difficulty seeing at night, sensitivity to light and glare, fading or yellowing of colors, and frequent changes in prescription glasses or contact lenses. Let's start off with what a cataract is. A cataract is the clouding of the eye's natural lens, and this causes visual symptoms. Your lens is clear when you're young and then turns yellow as we mature. It becomes progressively more yellow, eventually brown, then sometimes black. They can also sometimes appear white. Cataracts can develop gradually, and symptoms may worsen over time, prompting the need for surgical intervention, which is the only form of treatment. Some cataracts develop quickly. The purpose of cataract surgery is to remove the cloudy lens and replace it with an artificial lens. The benefits include clearer vision, better color perception, and reduced glare. It enhances quality of life, such as making it easier to perform your activities of daily living, reading, driving, or seeing faces. There are customizable lens options, and depending on your needs, there are different types of intraocular lenses that can correct nearsightedness, farsightedness, astigmatism, and potentially reducing your dependence on glasses. Now, there are some risks with cataract surgery. While cataract surgery is generally safe and effective, all surgeries carry some risk. These include infection, a rare but serious complication that may require additional treatment, bleeding. This is also uncommon, but can occur in and around the eye. Mostly inside of the eye is the most serious form of bleeding. Swelling or inflammation. This may cause temporary discomfort or blurry vision and is usually easily treatable. Retinal detachment, a rare condition where the retina pulls away from the back of the eye, which requires further surgery. Increased eye pressure. This can sometimes occur after surgery and may need medication or additional procedures. Vision changes. Some patients may experience double vision, halos, or difficulty with night vision. Need for additional surgery. In rare cases, further procedures may be needed to adjust the lens or address complications. And vision loss. Although extremely rare, there is a small risk of partial or complete vision loss. The overall risk of serious complications is very, very low, with over 95% of patients achieving improved vision without significant issues. Many patients ask me, when is the right timing to have cataract surgery? Well, it depends on you. If your cataracts are affecting your ability to see, to drive, to see faces, to watch TV, needing more light, then it's probably time. Your surgeon will also help determine if there are other reasons for vision loss. Now, there are some alternatives to having cataract surgery. One is observation. If your cataracts are not significantly affecting your daily life, you may choose to monitor them over time. There are some non-surgical options. Updating your eyeglass prescription, using brighter lighting, or wearing anti-glare sunglasses may help manage symptoms temporarily. And you can most likely always delay surgery. Not all the time, but in many cases. However, your cataracts typically will worsen over time, which may further impair your vision. Intraocular lenses, or IOLs for brevity, are artificial lenses implanted during surgery to replace the natural lens. They are biocompatible and very well tolerated. The goal is to match the selected lens to your lifestyle, vision needs and desires, and budget. There are numerous makes and models of intraocular lenses out there on the market, too many to mention, so this slide will be a brief overview of the general concepts of intraocular lenses. The first is a monofocal lens. We also call it a standard lens, and one type of specialty lens, which is also monofocal, is the light adjustable lens. Monovision is not a lens, but a strategy using monofocal lenses. The next category are multifocal lenses, for which there are two main types, bifocal and trifocal. For bifocal, EDOF stands for Enhanced Depth of Focus lenses. And then lastly, there are toric intraocular lenses, and those are lenses that correct for astigmatism, and we'll have a slide for each of these lenses. The first lens we'll talk about is the monofocal IOL. It's also known as the standard lens or the insurance lens. It provides excellent visual quality at one range of vision, and that range of vision could be near, such as reading a phone or a book or pills, intermediate vision, such as your dashboard or a computer, or far away, such as driving or watching TV. It has excellent clarity, however, the least amount of range. This lens is covered by most insurance plans. The light adjustable lens is another type of monofocal lens, but with the added technology of adjusting the power of the lens after surgery. This can fine-tune vision. There are some benefits. It's customizable vision correction after surgery. Vision can be corrected to near, intermediate, or far with precision, but not all three. It can also treat certain amounts of astigmatism. There are some limitations with this lens. It requires multiple post-operative visits for adjustments. It's a higher cost and there's limited availability. This lens is best for patients wanting tailored outcomes and willing to follow the adjustment protocol. Monovision is not an IOL, but a vision correction strategy used to avoid wearing glasses. One eye is corrected to see well in the distance, and the other eye is corrected to see well at near. These are done mostly with monofocal IOLs, but can also be used with enhanced depth of focus lenses. This strategy balances near and far vision without multifocal lenses. Therefore, there's a lower cost to this strategy than using multifocal IOLs in both eyes. There are some limitations, though. This may reduce depth perception. There is a period of adaptation, and it's best for patients that are comfortable with not needing perfect depth perception. Usually, people have already experienced monovision using contact lenses. Now we'll start talking about the multifocal intraocular lenses. The first one I like to talk about is an enhanced depth of focus intraocular lens, or you can consider it a bifocal intraocular lens. This type of lens brings the focal point of your vision usually at distance vision as well as intermediate vision. I like to call it dashboard to distance. However, you can also make it where someone's near point is the intermediate vision, which is dashboard or computer distance, and near vision, but not all three, near, intermediate, and far away. The benefits of this lens is that it does reduce your dependence on glasses for multiple distances, and it's ideal for people with an active lifestyle, such as driving and sports and computer work. Some of my patients have expressed they're able to read up close, for example, their phones, for short periods of time. But if they want to see small print or read, then they put on some reading glasses. Usually the power of the reading glasses is less than the power that they would need if they did not get a enhanced depth of focus lens. If you look at the picture, you can see a small target in the middle, and that's the center of the lens that allows the technology to give someone an enhanced depth of focus. There are some limitations with this. It is possible to get glare or halos at nighttime, but it's pretty rare. And I like to say that it brings someone back to their vision at the age of 45. At age 45, you just started to need reading glasses, but not all the time. So that's what this lens can do. It does cost, there are out-of-pocket costs for this intraocular lens since insurance usually does not cover this lens. The last slide talked about bifocal lenses, and this slide will talk about trifocal lenses, which is another type of multifocal intraocular lens. As illustrated in the picture on the bottom right-hand side, there are concentric circles in the middle of the lens, and that allows the lens to help you see at 3 different distances: near, intermediate, and far away. I like to call it device, dashboard, and distance. It will help provide good visual clarity. There is a period of time where people have to adapt to this lens. We call it neuroadaptation. One of the downsides of this lens is night vision issues, such as having glare or halos or rings around lights. Now, this is a phenomenon that happens to everybody, but only about 1 to 4%, depending on the make and model of the lens, are people complaining about it. This lens is an added cost since it's not covered by most insurances. Now let's talk about astigmatism. Astigmatism describes asymmetric curving or bending of light when it enters the eye. People who are nearsighted or farsighted can have astigmatism, as well as not have astigmatism. When it comes to astigmatism correction in the setting of cataract surgery, we need to talk about astigmatism from the cornea. The cornea is the clear dome-shaped windshield of the front of the eye. If the shape of the cornea is like a basketball, then there is no astigmatism. If the shape of the cornea is like a football, then there is astigmatism. This type of regular astigmatism can be corrected with a toric intraocular lens. The image shows a lens with 3 little dots on either periphery, signifying it is a toric intraocular lens. The previously mentioned intraocular lenses come in a toric version, except for the light adjustable lens. The light adjustable lens can still correct certain amounts of astigmatism. Toric lenses are usually not covered by insurance, and so there is an added cost for this lens. Other options to correct astigmatism include glasses or contact lenses, arcuate incisions in the cornea, and even corneal refractive surgery. I'd like to further describe a visual range with this graph that's made by Dr. Uday Devgan of cataractcoach.com. This is someone's visual range with each type of lens, intraocular lens, and that is vision without glasses. So I'd like to orient you to this graph or this table first. So on the left-hand vertical column or the y-axis, you have quality of vision, from perfect vision at the top going down to very blurred vision at the bottom. As you go along the x-axis, on the left-hand side of the x-axis, that's distance from your face or your eyes, and as you go to the right, that's farther away from your face, so distance vision. So the green line at the very top is the perfect person with perfect vision, where they can see very well, perfect vision, so upper left-hand column, at all ranges of vision. And this might be someone that doesn't need glasses, who is in their 20s, 30s, early 40s, where they can see up close as well as seeing far away. So now let's talk about a person with a cataract in a typical patient. Not every patient, but just a typical patient. You see this pink fuchsia line, and as you get closer to the eye, so let's just say about at 2 meters, look at the 2 meter mark, it flattens out. 2 meters is about 6.5 feet. So at about 6.5 feet going into the distance, someone's vision is blurry. But when they want to see closer up, closer than 6 feet, it really drops off. It gets blurrier as you see closer. So that's just simulates graphically what a person with a cataract lens is in a typical patient. Okay, now we've revealed all the other lines, and let's go through this slowly. Let's take the dark green line. This is the lens of a 50-year-old healthy person and what they can see. So at about 60, 70 centimeters, which is about 27 inches away from the eye, the vision really drops. As you get closer in, the vision really drops. You can't see up close in a 50-year-old. But far away, as you move farther away, you can see well. That's, again, a 50-year-old, not much cataract going on in that 50-year-old. Okay, so let's say someone has cataract surgery and chooses a single focus or a monofocal lens. That would be that yellow line. At about 1 meter away, the vision is good going into distance. But as you bring your object closer to your face, between 1 meter and 50 centimeters, you can see that yellow line dropping off, and it's becoming blurrier. The next line we'll look at is kind of the darker yellow line, almost orangish, and that would be an enhanced depth of focus lens. One type of lens is called a Vivity lens, but there are others. And so you get a little bit, let's start at about 70 centimeters. You can see that, again, about 27 inches away, the vision is pretty clear. You can see where that dark green and the darker yellow line cross. That's about 70 centimeters, or about 27 inches or so. The vision is pretty good. And then as you get closer, you still have some acceptable vision, but then as it gets really close to the eye, then the vision drops off. And then going the other direction with the darker yellow or orangish line, the vision is pretty clear as you get from 1 meter to a distance. And then the last lens we'll talk about is the light blue line. And so if we talk about vision at the about 40 centimeter mark, the vision's pretty good. As we get closer to the eye, it drops off. And then at 40 centimeters, going further in the distance, you can see it drops down just a little bit as you get to about 1 meter. That's about 1 meter away, and then it starts to improve a little bit from 2 meters on into the distance. You can see that if you go to the far right, the quality of vision from top is the best vision, and as you go further down, you get a little bit less clarity of vision. And so that trifocal lens, you'll get a little bit less clarity of vision, but you get more range. You get closer near vision. And so you take time to look at this, and I think that this is a pretty helpful graph to figure out what each lens can do. I know that there are some simulators of your vision. There's some cataract lens simulators online that will basically simulate the same thing, but in a picture format. Okay, so here is a summary chart of different types of lenses. You have on the left-hand column standard lens, multifocal lens, monovision, again, that's a strategy, and light adjustable lenses. And there's some scenarios that each lens is good for, the pros and the cons. You can take your time to look at this chart to get a summary of the different types of lenses. Okay, wow. So there are so many different lenses to choose from, different factors to consider. There's your own lifestyle, what you like to do. Some people just like to read. Some people don't like to read. Some people like bird watching, so distance vision is important to them. So everyone has different lifestyle needs. There's also different budget constraints or not constraints, as well as insurance coverage. And there's people that have their opinion on wearing glasses. Some people don't mind it. Some people actually, it's the glasses hurt their nose or their ears, or maybe they've had situations where they're not really able to tolerate glasses. And what's really important is to consider your entire health, the entire health of the eye. It's very important that your surgeon looks at all the different factors of your eye. Do you have other things in your retina or your cornea, or inflammation or glaucoma or other conditions that make you not a good candidate for certain lenses? You should have a very thorough eye exam and discuss if there are other conditions in your eye that could impact the lens choice. Having prior surgery, especially refractive surgery, can also influence the type of lens that might be good for you. So definitely, bottom line, consult your surgeon. It is a customized choice. Not one size does not fit all. And so have that discussion with your surgeon. Now, another topic that frequently comes up when discussing cataract surgery is called the femtosecond laser. And this is a laser machine that can do some of the steps of the cataract surgery, such as making a corneal incision, making arcuate incisions, which correct for astigmatism. You can make the opening to the lens called a capsular rhexis, and it also can help soften the lens. Now, all of these steps can be done manually. Your surgeon can do that, or it can be done with a laser. Some benefits of the laser is that you get a perfectly centered opening of the lens capsule. However, there is some evidence that that opening is not as strong as the opening created manually, but typically it's not a big deal either way. And the laser is probably better at making arcuate incisions to correct astigmatism than it is manually. However, with the advent of toric lenses, which we talked about earlier, those are very good at correcting astigmatism. Please note that this laser is not covered by insurance, and so it adds cost as well as adds time to the surgery. This is a nice graphic I found on the internet just to illustrate a laser beam coming down. The lens is right in the center of the picture there, and it's got a circular opening, and this laser beam is coming down and making small segments of the lens to soften it. Another thing you might hear about at the time of cataract surgery is optiwave refractive analysis, or ORA. This is a measurement system that's performed in the operating room while you're having surgery. It allows for more data to be collected to help the surgeon decide on the lens, and it can help decide the strength of the lens, if there's astigmatism, where it is, and also how to orient the astigmatism lens. Now, this ORA is not covered by insurance, and so there's an additional cost, as well as just extends surgery a little bit. Definitely have this discussion with your surgeon. Now that we've talked about what a cataract is and what intraocular lenses are like, I'd like to talk about the cataract surgery process. So the first step usually includes a pre-op consultation, which is assessing the eye's health and to discuss intraocular lens options. You want to first figure out if cataract surgery will benefit you if you're ready. If you are ready and you decide to proceed, then you're going to have surgery where we remove the cloudy lens and implant an intraocular lens. And then there's recovery. Most people resume normal activities within a day, and vision recovers very quickly. In terms of safety profile, this surgery is performed millions of times annually, and it has a very, very low complication rate. It's not 100% risk-free, nothing is, but it is nearly there. Even in the best of hands, there can be complications such as retinal detachments, infections, and bleeding. While those are not good, devastating to have, it is extremely rare. Okay, so let's say that you've had cataract surgery and you're expecting to have excellent vision. There are numerous factors that affect your post-operative vision and satisfaction, and the results do vary. Even though it's a very safe surgery, the results vary. There's no guarantee of having perfect vision afterwards, although many times we get people very close to having excellent vision. And if we try to get you out of wearing glasses, we cannot guarantee spectacle freedom. There are some lenses that do increase your chances of spectacle freedom for some activities, but it's usually not 100% guaranteed. Now, specialty lenses, we talked about enhanced depth of focus lenses, multifocal lenses, LALs. There are others out there that this presentation is just not able to cover because of the breadth of different types of lenses, but I gave you an overview. But these specialty lenses, they're not for everyone, and so it's very important to have a discussion with your surgeon. It really is a customized treatment, and your expectations and realistic expectations are a very important part of your satisfaction. This ends the discussion on cataracts and intraocular lenses. I hope you find it to be a good resource for information. Please consult with your surgeon about your specific situation, and there are plenty of resources on the internet, but I hope that this provides a solid, honest summary of different options for you regarding cataract surgery.